everyone, and welcome. Our presentation today is one of 2018's medical innovations. These innovations are medications, devices, programs, or procedures that might not be completely new, but have been recently approved by the FDA and are starting to become more recognized. One of those medical innovations is gene therapy for inherited retinal disease. This CE course discusses what is gene therapy for inherited retinal diseases, what types of patients can use this therapy, what the treatment medication looks like, how it works, and what are the most common emergencies and side effects. This course provides the basic information, tools, and guidelines necessary to assist a registered nurse understand and manage a patient having gene therapy for inherited retinal diseases. At the end of this course, the registered nurse will obtain 3 continuing education hours. The idea of gene therapy has been discussed in the medical literature since as early as the 1970s. In 1972, Friedman and Roblin proposed that it was theoretically possible to introduce good DNA to replace defective DNA. Over the years, a number of gene therapy clinical trials emerged in efforts to treat genetic diseases of inborn errors of metabolism, all with varying degrees of success. The basic principle of gene therapy is to put corrective genetic material into cells to treat genetic disease. Several gene therapy approaches include replacement gene therapy, optogenics, addition of a growth factor, suppression gene therapy, and gene editing, have been proposed in attempts to treat various ophthalmologic conditions. Optogenetics focuses on creating artificial photoreceptors to restore photosensitivity. This is accomplished by gene delivery of light-activated optogenic tools, channels, or pumps to surviving cells such as ganglion cells that remain intact in the retinal circuit in various diseases. It has been posed that genetically added growth factors, proteins such as adenovirus-expressed endostatin and angiostatin gene products, could have anti-VEGF properties. Short interfering RNAs could be used for downregulation of gene expression, resulting in functional inactivation of the targeted genes. Finally, technology such as CRISPR, standing for Clustered Regularly Interspaced Short Palindromic Repeats, could allow editing of one or several sites within the mammalian genome. The most common type of gene therapy is replacement gene therapy, which involves replacing a mutated gene that causes disease with a healthy copy of that gene. It is first necessary to identify the causative mutated gene. This technology works best in autosomal recessive biallelic diseases with loss of function mutations. A vector is then created to carry a wild-type copy of the gene into the cell of interest. The transfected gene is not incorporated into the host DNA, but is expressed, resulting in production of a protein with normal function. Scientists and companies have spent decades perfecting the use of vectors for genetic material and identifying ways to deliver them to increase therapeutic efficacy and treatment duration. Early investigations uses viruses that delivered genes to every cell in the body, which triggered a massive immune response that could lead to organ failure. More recently designed vectors deliver specific genes to specific cells. What does this mean for nurses? We need to know how it works, manufacturers and/or models, what it looks like, how to operate, and common emergencies, malfunctions, and side effects. In December 2017, The U.S. Food and Drug Administration approved a form of gene therapy to treat children and adult patients with an inherited form of vision loss that may result in blindness. This gene therapy is the first directly administered gene therapy approved in the U.S. that targets a disease caused by mutation in a specific gene. Patients with RPE65 gene mutations experience night blindness, loss of light sensitivity, loss of sharpness or clarity of vision, and impaired dark adaptation. This gene therapy provides a working RPE65 gene to act in place of a mutated RPE65 gene. This working gene has the potential to make the visual cycle work properly again. One eye is treated at a time. After the first eye is treated, the second eye will be treated at least 6 days later. There is only one manufacturer at this time, which is Sparks Therapeutics, the maker of Luxturna, and the only FDA-approved gene therapy for patients with defective RPE65 retinal genes. Luxturna is given by a healthcare professional as a surgical injection beneath the retina of each eye.
When you find out that your son's going to lose his sight, you obviously just want him to be able to see everything and anything that he could.
14-year-old Jack sits at the kitchen table with his mother, Jeanette.
My thought was we have to go to Disneyland, we have to go see trees, we have to go to parks, we have to watch every movie that I ever want him to see, because in my eyes that he was going to go blind and he wasn't going to be able to see.
Jack rides his bicycle down the street in front of his parents' house, something he couldn't do well before.
Knowing that there was no cure, I felt there had to be something. So that's when we found the Foundation Fighting Blindness.
A drone flies up through the clouds, revealing the skyline of San Francisco.
I currently serve as the chair of the Scientific Advisory Board for the Foundation Fighting Blindness, really the premier scientists that are doing research in the field of inherited retinal degenerations.
Dr. Jackie Duncan sits at her laboratory imaging room at UCSF.
Every year, really, I think we learn a little more about ways that vision might be potentially restored to patients, or that we might be able to intervene in a disease course such that we keep vision alive longer.
My eyes didn't just get better in one night. It was over time. It gradually got better.
I wouldn't have met Dr. Pierce had it not been for the foundation. We had told him that as soon as it was FDA approved, we would be your first patient. And Jack was his first patient.
Various news articles tell the story of Jack receiving Luxturna and gaining eyesight.
I don't have to hold on to my friend's shoulders anymore when I go to a movie theater or go outside at night.
It is a really rapidly evolving field. The success of recent treatments leading to the first FDA-approved gene therapy, and certainly in all of ophthalmology, has led to a tremendous amount of enthusiasm and excitement and interest in the field.
Jack shows us how he can play basketball in his backyard now. He makes a basket.
The surgery is definitely successful. Jack can see a whole lot more. He can see in the dark. He has better peripheral vision. He's a lot more confident. He's a lot happier, I think. Smiles sometimes. Yeah, right now he's normal because he'll be punished after this. Like every other teenager not listening to his mother.
She's 100% right.
Luxturna is an adeno-associated virus vector-based gene therapy. It is a clear liquid that is injected through the eye into a specific retinal space. It comes in a sterile vial and does not have to be activated or mixed before administering. Administration is performed at specific ocular gene therapy treatment centers. Each treatment center is staffed with healthcare professionals, including retinal specialists, nurses, and genetic counselors. The staff at the treatment centers has experience treating patients with inherited retinal diseases and have been specifically trained on administration of Luxturna. Some emergencies or adverse reactions include endophthalmitis, permanent decline in visual acuity, retinal abnormalities, increased intraocular pressure, expansion of intraocular air bubbles, cataracts, and other adverse reactions such as eye redness, eye swelling, irritation, and pain. Thank you all for watching. Don't forget to follow us on LinkedIn and Instagram and subscribe to our YouTube channel. For any questions about RN training or development for your business or hospital, consultations and contracting, please email us at support@advantagenursingceus.com.